Thank you very much. Good morning. I want to thank Mike D'Angelica, Richard Scholik, and Tara Kent for their kind invitation to the symposium on autoimmune pancreatitis. And my goal today, this morning, is to present a general view of the clinical aspects and the Imaing studies that support the diagnosis of this recently described uncommon disease. To achieve this, I will start with a practical definition and a brief history of the disease. We will continue with the different classifications, and finally, we'll discuss clinical presentation and imaging studies. Autoimmune pancreatitis is a chronic inflammatory disease of the pancreas with a clear physiopathologic association with autoimmune mechanisms, with elevated levels of immunoglobulins, particularly IgG4, and with adequate response to steroid treatment. The term autoimmune pancreatitis was first coined for this rare disease in Asia, specifically in Japan. It is now well recognized and accepted all over the world, with a basis on histology and differences in clinical presentation. Two subtypes of IAP has been described. Type 1 could be described as the pancreatic manifestation of a systemic disease associated with IgG4, while type 2 is harder to characterize but has localized pancreatic changes and is often associated with inflammatory bowel disease. It is more prevalent in men in the 6th or 7th decade of life. It is relevant to mention that there is no international consensus on definition or diagnosis. Nevertheless, agreements have been achieved in different parts of the world, but they differ considerably in terms of the elements necessary for diagnosis. Sarles in France first described a type of chronic pancreatitis associated with hypergammaglobulinemia. Many years later, Yoshida in Japan described the disease with the term autoimmune pancreatitis. The strong association with IgG4 was found later, followed by the understanding of multiple organ involvement as a manifestation of the same disease process. This is the original work of Sarles. This is him in the picture with Dr. Uscanga, who is part of our pancreas clinic in Mexico City. Sarles' original report included 10 patients with a clinical presentation that is very similar to most reports published to this date. It shows that pain, jaundice, and diabetes are the most common clinical findings in these patients. It is worth noting that this article only had 4 references that included everything relevant on that subject at that time. It was not until 1995 that Yoshida published his work where he describes the disease and officially names it autoimmune pancreatitis.